My name like is Gina, like love.
Yeah, exactly.
But I just all I have a stacking joke. But whatever
I don't want to.
No. As long as you guys love me.
Oh, yeah.
We're good. I got this morning. I got it at 3. Actually playing 4 chords. Is this music?
Yeah. Yeah, I gotta get rid of all this. So, we did 5%. And I took a couple of
There's no shame here. No, that's fine. You're talking to me.
For me, you know what we need service providers because I deliver the service system.
I just emailed you because I saw it and I was like, I never called you.
I'm gonna try to see if I can get the
Flatline mental health addictions, which means the investments in community are working. And so what I want to do is I want to increase the people's interest in staying in the center. So I can continue increasing that. Eventually, we need to reassess what we're doing in hospitals, because I don't think that that's community-based programs. That's where they should be going. But I'm not a popular guy for that. I have somebody else start my car every morning. Because that, you go 1% across the board. Right? That's significant. $86 billion. That gives us a lot of money to do a lot of stuff. $86 billion, yeah. So, oh, that's been the last 10 years. When I came in, it was just under 80 billion.
The interesting thing with the center is also that, like, you have both the mental health and community organizations. You also have the community and social service organizations that just don't there.
Yeah. CCSS. See, that's my I to creating one municipalities and say one person responsible for mental health and community and housing. If you had that one person, because housing is really MCCSS and housing, but it's also health. So one person had oversight and was able to utilize the assets on the basis of efficiency as opposed to just putting them into programs. There's 48 programs in MCCSS that have health and mental health issues related to it that I have oversight of. And I have 400 programs in health addictions shouldn't be oversight over that. And then hold the money housing is fixed. So we're building frameworks. We're building systems that person gets on, they don't run out of times, they get off, they heal, but then because they don't have the social determinants of health addressed. So how do we get back? So you need to have that integrated approach to support everyone gets a shot. I push so hard that I think I'm making some I used to have it full hair like him. Now it's not like you. Too much pressure. How are you? I'm great. Here with my fellow You're one of the Roundtable. Oh, that's But the success rate is less than 50%. So the only way to do this is to create a channel But of the 280 first round operation, treatment, some people want to be like palliative care. And I'm not a grandparent, I'm not because people die, people are getting higher brain injuries, and there's so many people have a lot of drugs. And these are things that it's for so the whole idea now is we went 6 months to 2 weeks, so I could get some of the treatment. I decide my next year this time I'm having to start so within 72 hours, I need help. Treat up
Yes.
All right, well, got your attention, didn't well, welcome. Good morning to you all. Thank you for your patience. I shouldn't say patience, because we intended to begin at 9:45, but we wanted opportunities for people to dialogue and enjoy company, because this is a collective conversation that we're going to have. And so thank you for taking time. Listen, we know time is precious, so we are trying to jam-pack a whole bunch of different conversations into a very small window. So again, we appreciate you taking the time to be here, to have this really intentional, collective, focused conversation on Black mental health here in your region. And this is not the end by no means. It's a beginning conversation. And you know that one of the things, and hopefully you've had a chance to read some of the information on those cards, because it talks about hopelessness that happens when we don't address important issues like mental health. And we talk about lack of funding. We talk about, you know, especially over here, I didn't want to get out of bed. You all got out of bed this morning. I'm so glad to have you here, but that is not the reality for so many in our region, and we want to do something about it. So that's why we're here, and hopefully that's why what interested you in coming here. But before we get to all of that, a few things that just to get us started. First of all, my name is Clovis Grant, and I serve as the Chief Executive Officer for 360 Kids, which supports young people throughout York Region. And I'm so glad we have a lot of different folks in this room that we partner with, and I'm so grateful for that partnership. And it's that kind of partnership that's going to really help us move this initiative forward in terms of how we do more collective, focused effort on supporting Black communities around their mental health. First of all, I also want to thank the planning committee for just their labor. So Shanna Kay, Marcia, Valerie, Josie, Shernette, thank you for your hard work in really pulling this together. And I think a big round of applause for them and as well. I also want to thank the panelists. They will be introduced shortly. Again, they bring a ton of expertise to this space, to this conversation, and you will hear from them shortly. I do want to acknowledge Minister Chibolo. Thank you for your time and giving that to us. You just flew in from Ottawa and dedicating your time to us. He's the minister, as you know, of Associate Minister of Mental Health and Addictions here in the province, and also the MPP for Vaughan Woodbridge. And so I believe Minister Lecce was one also on attending. So you can tell him that we did announce him when he comes in, and also MP Johari from Richmond Hill also had committed to attending. So thank you for that representation. A few housekeeping items. Hopefully we don't have any emergencies, but we know that there are lots of emergency exits, one right here, and about 3 in that main hallway. So again, I have to tell you this, but we hope we never have to use it, right? But that's where they are. Washrooms, you do have to take a bit of a walk down by the front, and to the left, there are public washrooms there. So if you need to go, please, of course, you don't need to raise your hand and do that, you just go. There are some snacks here, but there will be lunch to go as well. That's going to come near the end of the day, around 11:30, 11:45. And so you can take that on your way out. We will not have a designated break, so please, as you wish, if you want to grab a drink, if you want to go to the washroom, just do that, because we will not actually have time for a break. Having said that, we also recognize that some of the conversation may be triggering. We may be reading some of the signs, may be triggering to some. So we do have Shauna Kay and Marcia, who will be in rooms 10010, which is really just down the hall to the right, the first room on your right. If you want to have a conversation, if you want, they're therapists, so if you want to have a space to decompress and talk, they're there all morning to support you in that. And so I think those are all the things that I was commissioned to do here in the beginning. So I'm going to hand it over to Shernette to start us off with the land acknowledgement. Shernette.
Thank you so much, Clovis. Good morning, everybody. Good morning. As Clovis said, thank you all for being here. We'll start with the land acknowledgement, just to give thanks for the land that we were on. So today we stand on traditional territory of many nations, including the Mississaugas of the Credit, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people who have been caretakers of this land since time immemorial. We pay our respects to elders, past, present, and future, and extend that respect to all Indigenous and First Nations people. We respect the enduring strength of our Indigenous brothers and sisters and acknowledge that sovereignty was never ceded. As they continue their efforts towards reconciliation and healing from the past horrors of residential schools, treaty wars, and racial discrimination, we walk with you, beside you, and behind you in peace and harmony. We mourn the deaths of the thousands of missing and murdered Indigenous women, and we mourn the lives of the thousands of young children whose graves the earth has eased to the surface. And we pray for those who are still missing and unfound. As we gather here today, we will respect the land on which we stand, the air which we breathe, the waterways that bring forth life, the skies that provide a canopy for us, the animals that roam on earth, below, and in the skies. The Haudenosaunee philosophy states that words, works, and actions should reflect on the 7 generations before us and consider those that come 7 generations after us. So, it is within this spirit that we pledge to work together to be thoughtful stewards of this land and remember the sacrifices of our Indigenous leaders and ancestors. Miigwech. And so we're going to have a libation from Elder Lee. We're so happy that Elder Lee can join us. One of our treasures of the community, Elder Lee.
I'm first going to say greetings in some of my ancestors' language. Habari. Good morning. Hello. How you doing? How are the children? I will ask. And hopefully we'll get some of those answers today. I'm going to pour libation, but anyone, can you take out your phone and I want you to search how many times is libation mentioned in the Bible. Can someone do that for me? How many times have libation been mentioned in the Bible? The reason why I'm doing that is that the last time I did it, someone asked me, why am I calling them ghosts? So I want to clarify, to put everyone at ease, regardless of race, creed, or religion. Anyone?
It says 39 verses.
39.
I thought something that said 39 verses.
39. Okay? 39 times that libation has been mentioned in the Bible. So, Reverend, it is a part of us. In Genesis, Job laid an altar and poured oil. So let me say that what I will be doing is giving thanks to the ancestors, giving thanks to Mother Earth, giving thanks to the elemental energy, the elemental spirit, and last but certainly not least, giving thanks to our ancestors. So I will start by just saying, Creator, we call you by many other names. We thank you for this day. We thank you for the resistance, the resilience. We thank you for bringing us here safe. And we ask of you to bring us back home to our children, to our family. I say drink in style. Mother Earth, Asasaya, you are our womb that we came from. You are the womb that we return to. We use you, we abuse you, yet you continue to feed us. I say thank you. And drink. The elemental spirits, the breath that we take, the light, the water that we pour, we thank you for healing us, for the energy you bring us, the medicine you give us. We say, inside, drink. Ancestors, we stand on your sturdy shoulders. If we stand tall, it's because we stood on your shoulders. You have fought against racial discrimination, anti-black racism. You fought for social justice. We say thank you. Drink. You fought against gender. You fought for gender equality. You fought for peace. You fought against slavery. Because of that, many of you are at the bottom of the Atlantic Ocean. We say drink. We're speaking about people like Marcus Garvey. We say drink. We're speaking about Bob Marley, who says get up, stand up for your right. We say drink. We speak about Maya Angelou, who says, again we rise. Drink. We call on people like Brother Louis Marsh, who have joined the ancestors, who have always speak about zero gun violence, and us be able to help our youth. I hope the conversation today will speak about how healing mental health will help him as he labors to achieve his goal of zero gun violence amongst our youth. I say, and drink. I ask you to call the names of the people that you would want their vibration, their energy to be a part of your space and this space. Anyone?
Jay Williams.
Insar, drink.
James Baldwin.
Insar, drink.
Dejan Dick.
Insar, drink.
Tucson Overture.
Insar, drink.
Sam Sharp.
Insar, drink. Insar, drink.
Hub Ogle.
Insar, drink.
Tanner Christoph.
Insar, drink.
Kola Ilimane.
Insar, drink.
Yashima Bedford.
Insar, drink.
Sojourner Truth.
Insar, drink.
Anna Asafia.
Drink.
Josiah Hansen.
Drink.
Eden Zinga.
Drink.
Marcus Garvey.
Drink. If we call one, we call all. As I mentioned, let's not forget the ones that are lying in the bottom of the Atlantic Ocean. May we also not forget the youth who have been killed, who have been murdered. May we all give a moment of silence for them, because many of them are killed, are murdered, are the perpetrators because of mental health. And I hope that we acknowledge that today, that many of these gun violences within our city is because of racism, poverty, which creates mental health. Let's have a moment of silence for our young people. Thank you, and God bless you. Ashe.
Thank you. Thank you so much. Oops. It's okay.
So thank you, Elder Lee, for leading us in that libation. Good morning once again. My name is Marcia Hibbert, and I am a registered social worker and a psychoanalytic child psychotherapist. I run a practice in York Region in Newmarket, and I run a practice in Newmarket, and my main focus is infants, children, youth, and their families, and I specialize in working with parents. I also have a special interest in working with children and youth who are in the BIPOC community and who have been harmed by violence or racism in schools. I work for a private collaborative that offers a unique platform of work with school administrators and parents and teachers to help them learn how to reduce the stress for these children and also understand their world, get to know what their needs are. I also, as a practitioner, I wanted to share with you today that I've been working in York Region, Newmarket for many years now, and I have come upon a lot of Black parents that have come to my attention and said to me, you know, it took me a long time to find you. And we've been on wait lists for a year, maybe 6 months or so, and our children are suffering. And they've expressed to me that there's services out there for them, but there's only a few hours, maybe 1 or 2 hours. But I'm saying to you today, is that enough to help our racialized people or Black people? Is that enough to treat racialized trauma and stress? I say no. But I'm glad and I'm excited to be here with all of you today, and I hope that we can start to think about this together. Thank you. Shannon?
Thank you, Marcia. My name is Shanna K. Stevens, and I'm so honored to be here. I am a registered social worker and mental health counselor for the province of Ontario. I'm also a community healer and mental health advocate. In my professional private practice, we come alongside individuals, couples, and families and communities in their pain, suffering, and various forms of oppression. And we provide tools for these populations to heal and thrive in the region of York, Peel, and the Dufferin County. In the context of this roundtable, I'm particularly concerned with the fatigued bodies of our mental health practitioners and Black community leaders, which are riddled with stress, burnout, and compassion fatigue, as well as the dysfunction and fatigue related to the systemic trauma and oppression they've experienced. And so today, as we continue to move through life, as we did this morning, commuting through different parts of the city, rushing through traffic, dropping our children off to school or their respective childcare spaces, while simultaneously sending that last but important email to a coworker. The reality is, we normally ignore our bodies, our thoughts, our emotions. As Black individuals, practitioners, and parents, we recognize that the spaces in which we work, those spaces in which we seek support and care for our families and communities, project our ideas, oppress our bodies, marginalize our abilities, and re-traumatize us, which hinders our ability to provide care for ourselves and our families, and thus erect barriers on the pathway to healing, leaving many fatigued. Let us take the time to honor our thoughts, emotions, and bodies. Let us enter this moment and be intentional, and pay attention to what we're doing to our communities, our families, and ourselves. Let us be solutions focused.
So right now, we're going to intentionally take space, and we're going to slow down and prepare for this discussion.
During this roundtable, we will be discussing and having conversations around identifying the strengths and needs for our Black mental health program in the York region. For some members of our community, having these conversations and retelling the suffering we encounter as a community can be traumatizing. Hence, it's important for Black individuals to prepare and protect themselves emotionally and psychologically prior to meetings of this nature.
And this is why we are going to be engaging in this mindful moment right now. So now, we're going to take some time to get in touch with our bodies, our thoughts, and emotions. We're going to do a mini version of a body scan technique to gain a better sense of ourselves in relation to our community and surroundings. And some of you might know this is mindfulness. So to begin the process, if you feel comfortable, please close your eyes, be still, pray, pause, do whatever you need to do to help yourself look inward and seek self-awareness. Block out any external noises. Do whatever you need to do to be grounded, to be present.
Let's begin. Let's start paying attention cognitively to our thoughts. Now, let's start paying attention somatically to our bodies. Take time, take a moment to notice. Notice your head, your body, your legs, your feet. Notice any tension, any sensations, any tightness in the body. Now, breathe in peace, unity into these areas of tension. Hold for 3 seconds. 1, 2, 3. Now exhale to release any anxiety or emotions that may have come up. Take a moment to notice yourself. It may feel the same or different. The key is just notice.
You're welcome to open your eyes. For politicians and stakeholders and community leaders, as we move forward today, let us keep in our minds those who have fought for York Region's Black mental health community before us. And let's remember those who we've lost along the way. Inhale peace and unity. Exhale anxiety.
Let us hold a collective breath as we recognize the strength in our numbers today. As we work together, let us remember we are working for York Region's Black community, and we all need to be held accountable to ourselves and each other. Inhale, strength in numbers. Exhale, disunity and division. Today, in this moment, we welcome all thoughts, perspectives, and lived experiences into this space.
Yes. And I want you to recognize that we have mindfully co-created in a united and collective space.
Thank you for participating in our mindful moment. Thank you for taking the time to take care of yourselves and each other.
Thank you, Shannon.
Thank you, Martha.
That was wonderful. Thank you so much, ladies, for that. You know, we get so busy and we forget how important it is to be able to center ourselves in spaces sometimes and to really focus on, you know, what they're speaking about in terms of our breath, what we're feeling, what we're going through, and just taking care of our health. Because health is part of resistance. Rest is a part of resistance. Self-care is a part of resistance, because we can't do any of this work unless our bodies, our minds, our spirits are sort of, you know, well, and then we can go forward and do the work of the community. So as Clovis mentioned, the ladies are just outside to the right. If you need some time to even just speak with somebody, or in your agency or in your personal life, you're looking for a Black therapist, somebody who can work with you, your family, your colleagues, or your community. These ladies are incredible and they're available. All right, so we're going to get into it. All of our panelists are here. We're thrilled to have some of the, you know, the most sort of influential, respected leaders when it comes to not only the Black community, but in the work of mental health research, mental health practice, and forwarding the agenda of really looking at mental health in a very sort of molecular level, and being able to transform what mental health used to look like, and bring it into sort of what Black families need, because there are unique differences with mental health dealing with Black youth, Black women, Black men and families, than in other communities. So the panelists here today are going to speak on a variety of topics and questions, and so we're very excited to have them. As I introduce them, make sure you guys have a good walkway here. Can you just move up just slightly, just for them to walk here. You guys can come through this way. There's no seating panelists wherever you want to sit. These little black things that look like, I'm not sure, almost like, yeah, they're mics, they're microphones. So our photographer and videographer, Ravon, is at the back, so we can pick up everything that's happening at their panelist table. So those are ready for you. So I'd like to call on our panelists. I'll start with Minister Isaac Lopon. Minister Isaac is a religious minister, director of Miracle Arena Shelter, and a member of the IAWPA IWAPA, founder of a Divine Security Group, and recently he has hosted the Gun Violence and Human Trafficking Roundtable discussion in New York, to community nights with Tel Aviv University Dr. Yael Brahat, and also to leading local evangelism groups in the community. Minister Upon believes the humanitarian focus has no boundary. Recently, as director of Miracle Arena Shelter, he has initiated the supporting and housing of African asylum seekers and refugees with acquiring mobile units for interim transitional housing. And as a result of much advocacy with the community leaders in awareness of asylum seekers crisis, he has been fighting and bringing the issue to municipal and federal levels to assist vulnerable persons around the GTHA. So please welcome Minister Isaac to the stage. Our next panelist, Pastor Eddie Jumba. Pastor Jumba identifies as a Ugandan-Canadian Christian husband of one wife and father of 3 children. I love that one wife. I love it. He is a servant leader at heart, an ordained minister, and registered psychotherapist. He has over 20 solid years of passionately doing managerial and frontline work in the social work, mental health fields, child welfare, clergy work, and social justice. He has worked with excluded families and individuals with special needs in Canada and Uganda. He is passionate about finding the best in every human, and he dares daily to learn, unlearn, relearn, to do and be better professionally and personally. Ladies and gentlemen, Pastor Eddie Jumba. Our next panelist, Liban Gabriel Makael. Did I butcher that? I was okay. I was okay. Liban has over 30 years of experience in primary health care, social services, mental health, and community capacity building and development field. He holds an MA in migration, mental health, and social care from the University of Kent, UK, a master's certificate in healthcare management from the Schulich School of Business, and he has completed community health leadership program at the Rotman School of Management. In 2021, he also completed the Strategic Perspectives for Nonprofit Organizations program at the Harvard Business School. Ladies and gentlemen, Mr. Liban Gabriel Makael. Next we have Michael Bowe. Michael Bowe is an experienced senior equity and inclusion leader with a demonstrated history of working in the nonprofit social services sector. He is skilled in equity audit, strategic and operational planning, facilitating professional development sessions for the board, for school boards and different staffing levels, executive coaching and mentoring and leadership assessment and development. Michael is also working with policy and practice reviews, service and performance evaluation, along with community engagement and capacity building. He is a trusted and respected equity specialist and leader in multiple sectors across different regions and in the province of Ontario. Please welcome Michael Bowe. Our last but not least panelist, we're so happy that he's with us today, is Paul Bailey. Paul is a sought-after strategist, urban planner, and executive director at the Black Health Alliance. Paul has spent the last decade designing interventions focused on improving outcomes for Black children, youth, and families as it relates to health and well-being, community violence, mental health, and addictions. Paul is currently working on social planning, health equity, as well as addressing the causes of neighborhood distress and inequality. Please welcome Paul Bailey. All right, thanks so much. So what we're going to do is just allow the panelists we'll start from Paul to Minister Isaac, just a quick hello and greeting, something you'd like to say about yourself or about the day or just why we're here. To introduce you, and then we'll get into our discussion. So we'll start with Mr. Bailey.
Something about...
yeah, like if you want something about what you do. I didn't mention the work with the Alliance, but whatever else. Can you guys hear at the back? Not really. The fan.
Sure.
Yeah. Okay, if you guys could raise your voices a little bit, that would be great. Thanks.
Can you hear me in the back?
Yeah.
Great. I know how this looks. So I'm hoping that we can engage in a bit of a conversation. I know perhaps all men, those of us who are around the table identify as men, and I think it's important that we have a round conversation. As for Black Health Alliance, our work is really about seeding and supporting ideas that improve the health of Black people in Canada. Some of the work that we've done over the past 25 years has been seeding and supporting the initial start of Taibu Community Health Center. We've done a bit of work supporting something called a substance abuse program for African Canadian Caribbean youth, scaling that into a provincial program, and a bit more work recently working in Peel with Roots Community Services and other partners on
the Peel Black Health and Social Service Hub. The work that we do is really about listening to what communities is identifying as the challenges and barriers to their health and well-being, working with those communities to put research, whether that be qualitative or quantitative, to that, work with folks again, as I said, to design those solutions and essentially do whatever it takes to try and get those things delivered. There's a lot of need and a lot of work to do, but we're committed to doing the work with you, and so perhaps I'll leave it there.
Thank you so much, Paul. Michael?
Okay. I'll keep it brief, but it's really good being home. I live in York Region in Vaughan, but I work primarily in Barrie. I transitioned from York Region Children's Aid Society there as their equity lead to be the senior equity manager for Simcoe Muskoka Family Connection. So I'm really out of region, if not virtually at least. I do work virtually from Vaughan for the most part, but it's good to be in community and be able to engage in this way. And I think one thing that comes to mind, and perhaps we'll get into it because it is a big part of mental health, especially when you're speaking of this community, is the fight to get the name of Vaughan Secondary School renamed to Holden Alea Secondary School, which was very personal, and I witnessed firsthand the 5 black women leaders and, of course, Elder Lee Miller, role in getting that name change and the struggle and the mental health wear and tear on them that took place, and the community in general. So I just want to throw that out there just to center my voice in community, given that I'm often in Simcoe.
Thank you, Michael. Lieben?
Good morning. Very honored and looking forward to the conversation that we're going to have this is a very important conversation, very serious conversation. Taibu has been in existence now for about 16 years, going to 17. We provide primary healthcare services, but most of the work that we do is in communities and doing health promotion, health prevention, and some community capacity development work. And I think in the conversation that we have, at least from Taibu's perspective, one of the things that we are trying to do is develop models of programs and services that truly speak to who we are as a community and building some kind of an Afrocentric model of health and well-being. And so I'm looking forward to that kind of a conversation. When we're talking about mental health, it should not be, or I hope it will not be, in isolation of all the other things that we face as a community, because they all have a bearing. And so a broader conversation is what I'm looking forward to. So thank you.
Wonderful. Thank you so much, Lieben. Pastor Castro.
Thank you, Shannon. Hello, good morning, everyone. My name is Eddie. I am so delighted to be here this morning. The reason I said I'm a husband of one wife because where I was born in a family of 3 mothers and 19 siblings. So it's not obvious how many wives a man might have. And it's not something that is shameful at all. I don't mind sharing that. The reason I'm here is because of my core beliefs about people. My core beliefs about people are informed by my fundamental beliefs that I learned from the Bible. So it is something that I really treasure. As I look at people, there's something that I believe at the core about how they should be treated. Many of you would have maybe come to know me a little bit more publicly because of the recent times of how we responded when people were sleeping on the streets, in particular black people. But even that, my restlessness was because of what I believe about people. So I'm really looking forward to this conversation, and I could not thank enough the organizers who have, as many on whose shoulders we stand, have seen an injustice, and they have said, no, we can't just be like everyone else and just sit and watch. They said they're going to do something, and for me, I'm very honored that I am part of this conversation, and I look forward to where this will lead us as it is an initial step into something that is big, and I'm just so happy that we are here today. Thank you.
Thank you so much, Pastor Juba. And Minister Isaac.
Thank you, Shanette, and to the entire panel. I'm very honored to be here. Oh yes, I have to get used to it.
Oh yeah, you need to get
my voice is not loud at all. Good morning to everybody. I'm appreciative to be here, honored to be here with all of these panelists. I've come to find out that in the different regions and cities and counties that I've lived in, the mental health challenge is different everywhere. In South Carolina, I had some experiences, and at that time, that was the third blackest state in America. In New York, I had some experiences. In Toronto, I've had some experiences. In Shelburne, I've had some experiences. And in York, the experiences are also different. Depending on where we are, the struggle is the same everywhere, but every town, county, or city has its different challenges. So I'm very excited as we're talking about York region specifically, the challenges, and even hopefully we'll touch on some of the strides that we have accomplished and gone through in this region. I'm very excited to see how this conversation is going to go, the different areas where we're going to touch on, and hopefully we could bring healing to different solutions.
Wonderful. Okay, thank you to all the panelists for just a quick little bio, and also just to help us to understand how we are centering the conversation this morning. And I'm glad that actually Lieben mentioned that we can't look at mental health in a vacuum. It's more than just, having clinical support, because there's so many things that are problematic that lead to somebody needing, sometimes in an emergency situation, mental health support. So we can't just think we're going to solve one problem without looking at the other problems that fit into that problem. So I'm hoping the conversation really stretches today, and that we're able to really look at all of the areas of concern and be able to come away with some new thinking and a strategy to support Black mental health. So what we've done is we have some questions for the panel, and each panelist can sort of, chime in if a question kind of, it speaks to their expertise, or they want to sort of chime in with somebody else's question. And then after the panelists have spoken, we have a Q&A. So the audience, as you're listening, please take notes in your booklet. There's some pens at the front. Get your questions ready to speak to when the panelists begin. And then Minister Tobolo will speak after that period. And of course, he definitely wants to hear from you as a community. So I'll start with the first question. And since we went sort of right to left, Paul, we're going to do left to right this time. So you're not going to be first. We'll start with Minister Isaac. So the question is this. We're at the beginning stages of creating a mental health strategy that will have resounding success, because this is what we're trying to create in the region. Minister Isaac, how do we work together to shape a Black mental health strategy in York? What is the danger in not caring? And what does a community of carers look like? How do we today shape the next 5, 10, 15 years?
That's a wonderful question. I would say in building that structure here in York region, we have to recognize, we have to recognize the grassroots organizations, the B3 organizations that are already existing here in York region. We've been blessed, Mayor Clarina, to be connected with Anchor in the last little bit. But I believe if we're talking about structure, the government has to recognize, empower, and support such organizations to be able to provide services and help. Today, the companies that are organizations that are institutions that are, they are well known, well respected, and well supported because they were given a chance. Whether they're 20 years deep in providing service in the community, or 10 years or 30 years, they all started from somewhere. So I believe that we can create a structure if the organizations that are already existing are given some chance and are given some support to be able to provide these services. Because there's some services that realistically when I go in the certain areas in Thornhill, I know if Rabbi Daniel wants something done, he calls on his people to get it done. When we go to certain areas, be it in Young and Finch, and they want things done, they call on their people to get it done. Services are, whether we like it or not, culturally sensitive. So the organizations that are already there, I believe, will help the structure if the government is able to push and support existing organizations and empower them to be able to help the community.
And what do you think would be the outcome if we were not a community of carers? Because people could say, you know, well, for the last 50 years, mental health has operated in this way. And the community, you know, there wasn't any sort of huge push for something specific for the Black community. So why now? And if we don't have a plan, what is the danger of that? What is the danger of leaving things status quo and not creating situations, opportunities to really provide that kind of level of support for the Black community?
I think there are a few dangers. One or two that comes to mind. One is a burnout of our leaders. It is. We understand now the topic of mental health is very open. We speak about it more consistently in our cultures, regardless of our different traditions, whether we're coming from West, East Africa, the Caribbean. Community leaders, those who provide the healing, those who provide the counseling, they are well respected. Be it if they are storytellers, be it if they are priests or whatever the case may be, they're well respected because they're the ones that are seen in our communities that energize the powers that be. Everybody needs to have someone in their corner where they can go back and they can speak to, whether for counseling or whatever the case may be, that can bring that healing. So there was a time that I had something growing on my eye, and I'm not used to going to a clinic or hospital or doctor or anything like that. I don't know, I've been brought up that way. My dad first got a cramp and he was 47. He was an athlete and he never got a cramp before. And I told him it was a cramp. I explained to him how it works and he said, Nana, that's my tree name. He said, who told you that? It's a sickness. It's a cramp. Everybody gets cramps. My grandmother died at 111. I have, whether it's a blessing or a curse of old age, I don't know. There's long life in the family. But I've come to find out that as old as people get, there's one thing that's not there in my household, and that is the ability to relate and to be sensitive and to open up. People live long, but they carry burdens, and that alone kills you. People do a lot of work and they move to and fro, but they never get to speak. So it was later on in my growing up years I come to find out the importance of having an outlet for someone that you can go to that is a care provider. So certain things like the sleep retention and that the community leaders go through, we don't have to go through because we have an outlet ourselves. So in our community, the caregivers are so important. They're just like doctors. They're just like professors. They're not storytellers esteemed in my background as much as a physician. So I think that's very, very important. And the more that that's recognized in even this region, as we're talking about specifically, it will be a great help for them to understand that it's a need.
Yeah, thank you for that, Mr. Isaac. Anyone else on the panel? Yeah? No? Oh, okay. Yep.
Yeah. I think for me, when we're talking about the strategy, the importance of a strategy or a plan, for me it begs the question, who is responsible for our mental health? Are we responsible for our mental health? Is Minister Tibolo responsible for our mental health? Is the system responsible for our mental health? I think the strategy and the plan would help us to identify who's responsible and what is required, and elevate the conversation from the silo thinking about programs here and programs there, but really understanding what the problem is and then identifying what the solution is. I think the other piece for a plan and a strategy is also to make sure that there is ongoing sustainable process and effort that drives positive outcomes. I have said, and I continue to say, that we have a very good opportunity and the window that opened after George Floyd and COVID, and the window is closing very fast. And if we don't have a plan sorted out now, we may have missed a great opportunity where we have identified certain things. COVID has also helped us to understand how systems and government can work in situations. We just need to create that urgency to say this is a situation, a pandemic, or a crisis in our community around mental health, so that we can get that collaboration with the key stakeholders. Very, very pleased to have, faith-based organizations participate in this conversation, because we never had that opportunity. We need to bring more other faith-based organizations, because mental health begins in the community. It doesn't start at, sometimes we think that mental health starts at the hospital. That's why investment is done in hospital or other sectors. It starts in the community. And so how can we bring that attention to the community, where very grassroots volunteer organizations are doing much of the work but not connected to all the other systems? So this is why a strategy or a plan is very, very important. That also would include some kind of policies that would drive that strategy. I just want to acknowledge my mentor and my good friend, Denise Brooks, the late Denise Brooks, always said that if something is not put in policy or a plan, the chance that it will take any route or become effective is very, very limited. So I think that's why the importance, and when you're talking about caring, I think that's, the strategy would help us to enhance the caring that we have, but also the caring that we need from other stakeholders.
Absolutely. We'll go to Michael, Paul, and then we'll go back to
And I think in terms of a framework to develop a strategy that is equity-based, that addresses anti-Black racism in a way that is trauma-informed and healing-centered, in a way that is responsive, in a manner that is affirming and safe. We have to take our sort of lead from the World Health Organization that defines what the structural determinants of health. They call it the social determinants of health, but there's nothing social about it. It's very much structural, how institutions operate together to foster and sustain and amplify the conditions that we find ourselves in, and us being the Black community, given the nature of our talk today. So the World Bank really frames the condition in terms of the structural determinants of health as being the conditions that we are born in, that we live in, that we work in, that we play in, and too often we die in. And those conditions are shaped by the distribution of wealth, power, money, and resources, not only locally, not only nationally, but globally. So any strategy has to look globally and locally and be framed around the structural determinants of health. The lack of income security, lack of housing, access to internet, that's a big one. The lack of access to quality education, and so on and so on. I don't have to run through the social or structural determinants of health, but we need to frame it around that. And I think what, at least I'm sure other police departments does this, but what York Regional Police does very well is that they look at what's going on globally to understand what's going on locally in various communities. So if there's a conflict that breaks out, they'll go to the local community here in York Region and find out, is everything okay? Do you need any sort of support? Are you experiencing any sort of hate-related incidents or crimes? So any sort of strategy needs to incorporate that global lens, but of course with local action. And it has to be centered around our structural determinants of health, and think again with how our resources, power, and money is distributed, who has it and who doesn't. So I'll leave it there.
Yeah, thanks for that, Michael. Paul.
I'll try and be quick. I liked Lieben's turn of phrase, strategy or plan, because I think sometimes we get lost in the sauce of it. I think an action plan that's strategic, looking at the opportunities, looking at the alignments, looking at ways that you can connect different levels of government to drive the action that's needed is perhaps a way to frame and a way to start. So I live in Rexdale, and so like growing up, I just thought like York Region was rosy, right? Like until you learn a little bit about like the work that Mr. Grant does, and you know the different community, you don't realize like the broad diversity in the Black community up here, and then the broad diversity of need. We know, you know, mental health and addiction isn't kind of limited to, you know, any particular income group, but I think part of being strategic in this space is to amplify the local voices, the folks with lived experience as a key part of this work, because I think some of getting the resources to York Region is about changing that perception about like everything's, you know, rosy up here. I'd also add a couple more things. So there is something called the Black Health Plan for Ontario, and one of the priorities, if you will, the third section is really about, or the second and third is really about recovery and some of the supports that's needed. And so mental health and community-based care is mentioned there. And I think it's important to think carefully about, you know, once we're clear about what the needs are, how are we linking to that existing piece of work that's happening here in Ontario, but as well, I know one of my mentors told me, like, never go alone, right? So it's like you're going to meetings with the government, etc. Never go by yourself. Always bring somebody. It's not for witnesses. It's more about like recognizing the power of like the collective strength, the experience in the room, etc. And so I think, you know, York Region shouldn't be alone when, you know, we're putting that proposal in front of Minister Tibolo. We should be talking about I mean, I think you'd agree. We should be talking about the work that's happening across the province, some of which Mr. Tibolo has supported. I'm sure he'll give you an insight into our inside joke a little later. But we should be looking at those pieces of work and learning so that we can strengthen the work that needs to happen here in York Region. And lastly, I'd just say, you know, somebody spoke to the coordination that's necessary, etc. So much of the caring that we do is kind of off the side of our desk. It's volunteer, and not that I'm not diminishing that. I think it's important, right, to be in there and support family, support community, but you cannot do this work effectively volunteer. We've seen much more success, even just in our own organization, in ensuring that people have the supports that they need to be healthy and thrive when we've been able to resource that. But you know, what I've realized through speaking to Shunner a little bit more, doing a little bit more work outside of Toronto in the north, so Sudbury, etc., is that the context here is much different. We're not only facing the challenge of lack of services, so lack of services writ large, lack of services for the Black community. We're also facing the challenge of the lack of community infrastructure, the lack of funding for our organizations, B3 organizations, to support the communities that we're dealing with. And so I think we just need to wrestle with that a little bit as we think about the strategy. How are we, at the same time, asking for the operational support that we need to deliver the mental health or other services more effectively?
Yeah, absolutely, Paul. And, you know, we talk about strengthening the collective, right? But how do you strengthen the collective if the collective is weak, right? How do you ask of the collective, of the community, we want you to engage, we want you to you know, create the infrastructure and have these programs when they're unable to because they themselves are weak. And you know, Jeremy, you talk about burnouts. I mean, there are so many wonderful grassroots organizations that literally burnt out. They couldn't do it anymore. You know, there's only so much of volunteering you can do. So much of the running around with the 5 or 7 people before you have to pack it in, right? Your family needs you. You're dipping into personal funds to pay for what you need to do for community. And so we're losing a great deal of these grassroots organizations and leaders who have to call it quits. Not to mention leaders who have passed away, right? Doing the work that just was so tremendously difficult on their body and spirit. And so I think that's a part of the discussion as well. I'm a part of another collective, and one of the members said the other day, we need to have some mental health breaks in our Zoom calls, because for months we're going on talking about the problems, and it's the EDs and the leaders that are leading the conversations to help the people, but the leaders are burnt out, and we're not accessing the mental health. So if we want to strengthen the collective, we have to ensure this collective is not weak. We need to make it stronger, so then that ripples into community, and that's how we at least start the conversations. So thank you. Yeah.
And if I could tag on to that, and that's what I was alluding to when I first gave my preamble around hopefully we get back to how this impact on leaders. And the example I gave was first taking down the name of Benjamin Vaughan from Vaughan Secondary School, which was a fight, and then getting a black hijabi-wearing Muslim woman's name onto the school. And I saw the wear and tear, the weathering on all of our leaders in the community and the fight that took place, even though York Region District School Board had in their policy that all the schools named across the region was after white men. There was only one that wasn't, and it was a white woman. And in the policy it says the next schools, we have to name it after a black and indigenous person. Yet there was a massive fight to get that name put up there. And to close the loop, because for those who are unaware, Benjamin Vaughan, he owned 2 plantations in Jamaica. He fought vehemently to keep the institution of slavery alive. He was a part of the parliament in England, and he stood in the way, as well as Henry Dundas and others, even Simcoe, John Graves Simcoe and so forth, that where structures are named after. But anyways, he fought very vehemently, saying that if folks in Jamaica, if they end slavery, they would just go wild, they'd be uncivil, they'd be like animals running around. Slavery is actually keeping them safe and intact. But of course he owned those plantations that he got from his parents. So basically, that massive fight that took place to take the name down and put up, that was led by Shanette and Jerissa, I see here, that was also a part of the group, like, as I mentioned, Eldon Miller, Cheryl, who am I missing? Charlene, and so forth. Really fun, and I saw the tears, the harm, the hurt, the upset, the begging, the pleading, and so forth that took place just to get the name put on that school. So it does have a tremendous impact, this work, on our leaders, and it does in turn, having weak organizations that don't have the resources also impact community and our leaders, because they have to do that much more in order to drive things that should really be very basic.
Thanks, Michael. We'll go to Pastor Jim, but then we'll get to the second question.
Thank you. Man, I live in Keswick, so I go to Lex Simcoe every Tuesday for my mental break. Now, I don't know what I'm going to be thinking the next time I go there.
Well, it's considered ambivalent, and when they say ambivalent, an ambivalent slave owner, then they're trying to say it's a nice one.
So
he doesn't really want to be a slave owner, but he just...
I will still find a way of enjoying that water.
It was too good.
So what I wanted to talk about, first of all, is to thank you for how you are asking the questions, my sister Ashanette. I want to talk about the question of what does a community of carers look like? I want to speak to this from the lens of a faith leader, which I am, unapologetically. It's a blessing to me that I'm identified as such. I want to encourage faith. There are many people of faith in this room. I want to encourage you, if you are in that group that thinks, oh no, mental illness or psychology, that has no place in our, whatever your place of worship is, church, mosque, synagogue. You are missing an opportunity. And I just want to start there. I want to encourage all the faith leaders to, whatever barriers that, I don't know, society or some beliefs have put in our way, the barriers to working together with all the other groups that are doing so much good work when it comes to responding to mental illness or mental well-being, for specifically even for our black brothers and sisters. You are missing an opportunity, and I think you are not applying everything you believe about people. If you truly believe that all people are created in the image of God and they should be treated with dignity, you miss an opportunity as a faith group if you don't show up when conversations such as these are happening. So, of course, I'm preaching to the choir because for you, you showed up. But I just want to encourage whatever your audience is to really be okay with sitting in these kinds of places and really addressing the issue of mental health. But also, I appeal for a mutually respectful partnership between for example, a psychologist and a pastor, for example. I am in a very unique position. I am a registered psychotherapist, but I'm also I'm an ordained minister. It's not a luxury you find all the time. I am very blessed to be sitting in that intersection where these two worlds meet, psychology and spirituality. And I'm very honored to be sitting in that space. But I'm aware that not all ministers or not all clinicians are as equipped in that way. I just want to encourage a mutually respectful partnership, because when we partner in terms of community of carers, when we partner, so the clinicians and the faith leaders, when we partner respectfully, we are better positioned to serve the people that we are serving. When we continue to put these barriers, we are ineffective, we are inefficient, we don't do as much as we could have done had we partnered. Man, I appreciate how Elder Lee, what he did here. I don't know how much you were following everything he was doing, but the respect with which he attended to both worlds, that is what I'm talking about. But I am aware of this very unfortunate disrespect that sometimes is extended to faith groups when it comes to participating in conversations like this. Or, on the other side of the coin, how faith groups demonize psychology. That is unhelpful, it's unnecessary, and it does not equip us to serve our people to the extent that we could serve them if we partnered.
Okay, thank you, and I'm coming to you next.
Oh, you are?
For the next
Okay.
question.
All right.
Pastor Jimba, okay. So, York Region has the capacity to offer Black mental health support and resources, including training and programs. This work needs to be led from a Black-led collaboration with other B4 groups, York Region and surrounding areas, as well as allies, agencies across the area. In order to see what this work will lead to, we probably need to start now. This is the time, this is the moment. So how can sector agencies ensure that York Region has the support it needs to build capacity and mental health programs with existing Black-led agencies so that the Black families in York can receive mental health and wellness programs in their neighborhood? And I'll add this just to the end of that question. I love Taibu, and Liban is a part of Taibu, and he's seen me there. I live here just 10 minutes from this location. And I've had to go to Taibu to receive care for sickle cell disease, which I am a carrier. And I remember having to travel to Malvern because there was nothing here for me. And I would knock on doors of healthcare centers wondering, like, is there anything for sickle cell, anything for, and I had to come to Taibu, which is extraordinary in how they've built out what Taibu is and Black Creek and all of these other health providers. And that is a dream for me, is to have that replicated here. So in saying that, it's not that, we don't want to go outside of our region for care, because I've done it, but how can we do it here? What do we need to do here so that the people that live in York Region have what they need? And so the end of the question was, How do we work with Black agencies and allies in other sectors so that Black families in York Region can receive their mental health and wellness programs in their neighborhood?
Thank you, Sinead. Wow. So I want to start from here, which is where my mind and my heart was at the beginning when we started these conversations. That it was actually a slightly different question than the one you just gave me.
Oh, sorry. Did I you want me to go on?
Yeah,
that
it
one?
was the one on cultural competency.
Yeah.
Yeah.
It kind you want me to go and thread that through?
Yes.
Okay.
Yeah.
All right. So the need for cultural competent care and healing modalities is a must for our community.
Yes.
We need an understanding of cultural nuances and norms from across the diaspora in order to adequately meet the needs of the Black community. We, meaning the whole community, are architects of this response. But in so doing, we need to ensure that we have the right tools and the skill set to build a strategy. So there are many agencies currently programming for mental health support. Why do we need anything new or different for the Black community? Because this question will be asked, right? It's asked in your agencies, I'm sure. Well, why do we have to do that for the Black community? Or why do we have to hire for this position? Or why do we need to have an anti-racism strategy? Why do we need to have include? All of these questions will be asked. Maybe not of us, but there are people within our community who wonder why it has to be special, anything special for anybody else. So when the question is asked by other people that, why do we have to have a response that speaks to the experiences of the Black community, how can we make a case for culturally competent services and programs that support Black mental health?
Yeah,
what do we answer them when they ask us?
Thank you.
Yeah.
First, I'm going to start with a story. It's a story I learned when I was doing my placement as a it's called spiritual care practitioner now, but back then it was called chaplain. So when I was finishing my psychotherapy program, we were required as regular students from any program to do a placement. So I chose to do mine in a hospital. During this time, I was in a group of 7 men and women, and all of us were coming from different backgrounds in everything that you can think about when you think about background, whether it's faith or race, gender. It was a group of 8 very different people. So I had an opportunity of sitting for 7 months with this group. Boy, did I learn something about myself and how the reality of the people we serve being different works. Part of what I learned was a story, and I'm going to share that story with you. We were encouraged to humble ourselves when we come to the subject of being competent in someone else's culture. So there's a buzzword these days, it's called cultural competency. As I was coming in, it's the first thing there at the first board that you see on the left there where Mr. Grant is pointing. This is what it said. It says Black Canadians are 60% less likely to access mental health services compared to the general population in Ontario. Only 2.3% of psychologists and mental health professionals identify as Black, leading to significant gaps in culturally competent care. So it is a thing. It is a thing. It is true that when we think about how to respond to mental health needs of people, it is important that we pay attention to what culture they are from. So this is the story. The story of a monkey, and I'm just going to read it instead of just telling it. I'm just going to read it. It's a story of a monkey and a fish. This is how it goes. There was once a monkey and a fish. The monkey lived on a deserted island in the middle of a vast ocean. The island had, with its pristine beach, a single palm tree which occupied the monkey's day. He would climb up and down and swing on branches endlessly in the complete joy of his monkeyness. One day, a violent storm raged toward the island. With hurricane-force winds, the giant waves crashed onto the island, and the sandy beach would momentarily disappear from the monkey's sight. The monkey, however, was safe in his palm tree and enjoyed the battering winds that made the branches dance in the sky. Suddenly, the monkey saw the waves throw up a fish onto his beach. The fish, in a desperate attempt to return to the ocean, flapped its tail frantically. The monkey, seeing the fish in distress, scurried down to the tree at great personal risk and picked up the fish. And just as quickly as the monkey came down from the tree, he went back up again, carrying the fish to safety. The fish was still in obvious distress. Once the monkey reached the top of the tree, flapping its tail back and forth, nearly falling from the monkey's hands to its certain death back in the water. But the monkey held tightly, knowing it had rescued the poor creature from the perilous destiny. While still flapping its tail, the monkey gently caressed the fish, stroking its side in hope that the fish would know the peace and security of being with him in the top of the tree. After a short period, the fish finally came to rest. Oh, there was an occasional twitch, but the monkey ensured the fish with his gentle stroke and secure grip that he was still caring for it. Eventually, the fish quieted down completely, as did the storm. And the monkey came down from the tree to lay the fish back where the fish had found it, on the beach. He scurried back on top of the tree, and looking down at the peaceful fish lying in the sand, the monkey knew he had helped the creature and rejoiced at his efforts. That's the end of the story. Not every story has a good ending. There is, of course, a moral to be learned in this in the application of the story of the monkey and the fish. But perhaps the most appropriate question to ask right now in this in our current culture climate is to ask not whether or not the actions of the monkey were right or wrong, but how would you feel to have been that fish? And if I had the luxury of time, I would even dare get somebody to try to respond to that question, either on the table. How would you feel if you were the fish? Anybody?
We are at times the fish. Many times we are the fish.
In this moment.
Yes, in this environment.
How would you have felt when you were the fish? Unheard. Unseen. Helpless. Misunderstood. Now, anyone who tries to dismiss the need for culturally competent services is not any different from the fish. The fish believed, as many therapists out there, and I'm one of them, so I'm not pointing a finger. In fact, if you noticed, my fingers were pointing at me. The fish believed when you see people in distress, or let's go back to the story, the fish believed when you see other creatures in distress, you pick them up and you take them to that place where you feel safe. The fish was coming from a sincere ignorance, which to this day and age I don't think is permissible, because there's a lot of information about cultural competency. I'm picking this up because there's a book in here, very heavy book, an entire book about the subject. So we are really not even talking about a lack of awareness that you need to fund. I'm looking at the minister right now. I don't think there is a lack of awareness that, no, we really need to fund culturally competent services. I don't think there's a lack of awareness. What there's a lack of is the lack of will, financial will, political will. That is what would be the lack. So I am excited about this table because with the minds that I have here, which some have had opportunity of working with, and with the will and also the support from all the people in this room and whoever will care to hear about what came out of this, I think we are on to something great. But as a specific thing, when we talk about at least a 10-year strategy, we cannot talk about it in isolation, as already has been identified here. We really cannot. But there's so much we can talk about in terms of benefits. My brother talked about the framework already. When you address systemic inequities of black people in York region, we are, as a domino effect, also addressing the other people that are surrounding black people. There are so many other things. Culturally responsive care would be an outcome of this strategy if we're intentionally now focusing on addressing black mental health. Holistic community well-being, and I could say a little bit more if there's time. Promoting awareness and education. These all would be almost natural outcomes of the black mental health strategy. Collaboration and advocacy. When there is a formal strategy, this would definitely foster collaboration among other local organizations, which I touched on at the beginning. So in essence, we would be putting our money in a good place when we invest in a black mental health strategy. But I just wanted to really highlight from where I started that we cannot, unless we just refuse to open the books or just look at the reality, we cannot overstate the need for culturally competent mental health services in York region.
And thank you, Pastor Jumba. And what I really enjoy about your response is that this is literally embedded in what we're trying to say about the nuances of black culture and our identity. You started with an African parable or proverb. You started with a storytelling, which is so sort of immersed in our culture, is the storytelling. I grew up with Anansi stories. My parents taught me lessons with Anansi the spider stories. That was who I needed to make sure I was learning from those proverbs. And also through our traditional books and leaders and all of that. So even with you just sharing that is an indication that we just do things differently in a way that supports and heals sometimes the trauma. And when we use, whether it's animals and have the respect of, the animals around the earth to tell these stories, we've been brought up that way to tell stories that way. And so storytelling is an amazing way to sort of use that in a clinical sense when we're looking at therapy for young people, for black families. So thank you for using that within that response, because that really highlighted how we have traditionally basically have learned at the kitchen table. That's kitchen table therapy. We didn't go to therapy. We sat at the kitchen table and, your family gave you therapy. And so the stat that you quoted, that we don't seek mental health, that's extremely true. But I think because there has not been the infrastructure to go to seek it, so we need to start to figure out how we build that. So thank you for that. Anyone else on the panel? Yes, we would.
So from the work that we try to do at Taibu, we are developing some models and some principles and some goals. And so our goal is really, we have 3 goals, which is prevention, restoration, and advancement. And then within that, we're using key pillars in how we're doing things. We're trying to move from the word cultural competent, because I don't think anybody can be culturally competent in anything. So we're using terms like culturally affirming, and we also use the term Afrocentric ways of doing things. And just to say, because we know how the system was not created for black people and indigenous people here in Canada. The education system was not created for black and indigenous people. The healthcare system was not developed, right? So that system was developed with certain population in mind, and we have the indigenous, black, and racialized communities in the margin. And what we're trying to do is now bringing those people inside the circle so that they can feel the that the service that they're accessing, the education that they're accessing is speaking to them from who they are and who we are, right? So in that process, I think that's why we're using, number one, the first principle is anti-black racism, understanding that the challenges that we face is imposed on us because of anti-black racism, and that's the approach and the lens that we have. And secondly is how can we ensure that we bring our values and principles and education and teachings and rituals and ceremonies into the work that we do. If it's mental health, and how do we bring that into the space? So that's what we call the Afrocentric ways of doing things. And then the third principle is about system transformation. When you started with the question and say, how do we answer this question about why do we need, right? That was the question I got so many times when you know I came to Taibu is, why do we need a Taibu? And you know, then you have to go to data and say because X, Y, and Z, and because like you have to tell this big story. Now I think it's more evident why we need this, but I think our aim, and I've been saying this a lot now, and I've also started to say it to the board, is my and the team's work should be to put Taibu out of business. The reason why there was a need for a Taibu was because the system was not responding to communities in the way that they need to receive services. And so we also need to look at doing some system transformation and making the system accountable. Number one, to influence how they're doing their mental health services. So everybody who goes to any services should receive the services that they do. In the meantime, we need something that is focused on Black communities to develop that and to demonstrate this is possible. We're seeing this at Taibu in many of the work that we do, and others can adopt the way that we're doing things and changing that, you know, whenever this like mental health diagnosis and stuff was created in a way that did not acknowledge the stories and the histories and who we are and how the system has impacted us. So I think those ways of doing work is possible, and we need to do it, and we need to influence the system so that the system can also adopt this. Because, you know, there are going to be hospitals who are going to be looking after our community members, and if that system is not changed or transformed, we're going to have the separate connections of we trying to do something in the community, but the other systems are continuing to make things difficult for communities.
Okay, thank you so much for that, Eben. We'll go to Paul quickly, and then we'll get back to questions.
So I'll answer the previous question that you put on the table, like why do we need it? And I think I'm going to try and do it through like a data lens. So we're often like in these conversations talking about depression and anxiety, and that's important because that's the majority of what folk are going to be seeing. But the more and more I engage just recently in the community, I hear about the significant increase in young Black folks dying by suicide. One, two, substance use and addictions often gets left out of the conversation. And when we think about like psychosis and the need for services, doesn't really get focused to this concurrent disorder business. I'm not a clinician, so I just kind of learned this all on the fly. But what that situation is telling me is that the issue is actually massive. It is actually a crisis, and we need actually a strategic approach to addressing it. If I dive into the EPI for a bit, we're doing two things in the system. Like the conversation here is a little bit about like how do we fill the gaps of what exists. But like the province is actually spending money. We're doing things. So if I'm not mistaken, Minister, correct me if I'm wrong. Like there's a whole expansion right now around youth wellness hubs. How are we having a conversation about how those better serve Black communities? If I'm not mistaken as well, I think I just saw an announcement, 19 million for EPI services coming to the province. I don't know of one Black agency in the province that has an EPI program. What do we know about EPI services? We know that Black folks are at 60% increased risk of being diagnosed with psychosis. We know that we actually get to care through the most aversive pathways. So like our first contact is more likely to get through ambulance, the police or the emergency room, which is not the way to get the care. Other people get referred by their primary care physician if you have one. We know that when it comes to folks in care, we're over-restrained along with indigenous and Middle Eastern populations. And then we know that we're more likely to actually, than everybody else, to disengage from care. So all of those things together tell me that, one, there's a disproportionate issue which requires a kind of like a solution that's commiserate with that issue. But it also tells me that, particularly if we're more likely to engage that, and you ask folks why, it's because those services aren't being responsive to, one, their cultural needs and that need for affirmation, but also likely their other needs, the social determinants of health. So I'd leave it there and say, I think part of the conversation here for me is, sorry, I left out one stat that I have to add, because they're important. So I actually had the opportunity to go and tour, sounds weird, but tour the forensic unit down at CAMH. Because part of the conversation is, like, for folks who don't know what forensics is, one of the clinicians could probably explain it to you, but when you've been charged with a crime but not found criminally responsible, you might end up under the care of the Ontario Review Board and then in forensics at an institution like CAMH. Long story long, the stat there is that for young people under 25, 44 to 50% of the population there is black, or 5% of the province, 9% of the city. So that's disproportionality that I'm talking about. I'm saying, long story short, having the ability to go and tour and engage, it was, I think for me, one, shocking to see it, but telling as well, as I look at all the work that's happening and all the investment that the government's making, that we're not doing enough to really address the challenges perhaps around, again, not just depression and anxiety, but things like psychosis and current disorders and substance use. So I kind of just wanted to insert that in the conversation, but I'll leave it there.
Okay, thank you for that. I've just been told by some of the organizing committee that lunch is on its way and we're a little behind time. So we're going to kind of just go through the panels as quickly as we can. So let's perhaps go to, sorry, maybe we'll go to Liba then, and we'll talk about the question. Yeah? Okay, is that okay? And then we'll talk about the question that was asked to Pastor Jumba, just about how do we, I think we have touched on it, but how do we work with other agencies who want to know the why we need this service here in York Region. And I know the work you do in Scarborough and across Toronto is so sort of, so needed and so necessary. How do we build that same sort of, or leverage what we have here to do something similar in the region?
Yeah, so just continuing from previous conversation, I think data is going to be very important. So, having some local data, but also using other datas that has been mentioned now or exist out there is going to be very important. I think there may be some structures where we can have those conversations. I know when it comes to the health integration of services, OHTs now are, more or less responsible for planning health in our local environment. I think having some representation there is going to be key. Even with representation, we're talking about how difficult it is, how tiring it is to be advocating for issues like this. But I think representation at OHTs is going to be key. I think we're moving towards OHTs becoming the local service planning and integration. And if we don't have representation about, for black communities and other racialized communities, including black francophone communities, I think it's going to be a challenge. We have our OHTs in Scarborough, and even with representation, if you're not, like I usually say, if you're not at the table, you'll end up on the menu, right? So even being at the table, nobody asked the question to say, how about black communities? How about francophone communities? How about indigenous communities? How about newcomers and refugees? people have great conversation and planning and discussions and make decision without paying attention to what is happening on the ground. So I think representation on those places is going to be very important. I think things that have already started or has shown some improvements, I think also bringing those into Vaughan, I think will be very important. I know Black Health Alliance has played a significant role in, for example, in expanding the SAPACI program. I know Minister Tibolo has also been very supportive in doing that. Those are models that are existing and are already showing how access to those services are making a huge difference. So connecting those dots, I think, is going to be very important. And also, I think working with stakeholders such as, I see the police at the back there, very important. You know, we've seen the development of the Toronto Community Crisis Response Service. How can that be a model that can also exist here? I mean, that came out of a very painful situation, the death of Regis Korczewski-Paquet. Now the whole of the city has a community, a non-police-led community response around mental health crisis and well-being. Significant, right? So what are those models that already, I think maybe, you know, here in Vaughan, I think there may be some advantages because some things have developed somewhere else, and it's just how can we replicate them? How can we expand them here? So using local structures and then bringing in the connection and connecting the dots with other programs that have shown some improvement would be a few things to consider.
Thank you, Libet. Absolutely. I'm gonna. I know Helen may want to sort of chime in. We're going to go straight to Michael and then Paul, and then Minister Tibolo will have you end with your remarks as well. So I'll be very quick because sometimes my intro is a bit long. So Michael, can you talk a little bit about Black mental health being around, or the connection between Black mental health and mental health justice, and how do we ensure that we're looking at a solutions-based response with ostentatious goals, so that we don't miss this vital moment?
Well, I love the way you phrased the question. I do have it in front of me. Black mental health is mental health justice. And I think the connection for me with that particular phrase is the whole idea of universal design. If you design systems and our structures, whether it be roads and sidewalks and all that, to benefit those who are least advantaged in our society, it scales up and benefit those who are the most advantaged. But oftentimes we design our institutions or city structures and all that to benefit those who are the most advantaged, those who are tethered to structural advantage, right? And it doesn't scale down to benefit those who are least privileged. Sidewalks are developed that way in terms of having slopes down into the road to benefit those who use wheelchair. It scales up and benefit those who are using stroller, riding a bicycle, and so forth. So that's how we need to design our systems, and that's why I love this quote. Black mental health is mental health justice. So if you design things for the least privileged, it scales up to benefit the most, right? So I really love that part of the talk. Now, as noted, I think in terms of not making things worse and the gap larger, we do need to build our Black mental health strategy around the structural determinants of health, and already defined it for us in terms of what it is, and that we have to take a global gaze as we look locally in terms of our communities, because the remnants of slavery is still here with us, but also we have to look at the remnants of colonization and the continued colonization that exists across the planet that is fueling folks leaving their homes, not wanting to come here. People who are refugees from war-torn countries that are fueled by our need for wealth and for resources. What comes to mind is the Democratic Republic of the Congo, whereby 70% of our need for lithium batteries that drive our phones, our cars, it's everywhere, came from the DRC. And that lithium is mined. It's first mined as cobalt before they refine it into lithium. That's mined by 6 and 7-year-old kids that are dropped into the crevices of these deep shafts, sometimes 60 feet down into the earth, to bring up the cobalt. And sometimes they put them on drugs or don't feed them to make them work harder or longer. So basically, our consumption of lithium batteries comes from kids across the planet that then come here and drop in our communities. So we can't, when we look at black mental health, we have to look at it from those two lenses. The remnants of slavery that still exists and shows up as anti-black racism in the present, as well as neocolonialism that shows up in the form of anti-black racism. Colonies still exist. France has 12 colonies. They call them overseas territories. The United States have 14. Britain has 14. They still exist. Canada says they don't have any, and I believe them. But they also benefit because most of the mining companies across the planet, their head offices in Canada, in Vancouver in particular, and they're fueling the enslavement, human trafficking in African countries as well as elsewhere. Eritrea, that's an example of that. Whereby folks are coming here trying to find justice because in their country they can't, because they get killed if they make accusations against these mining companies that their head office is housed here in Canada. So we're still connected to what's going on, and colonization never ended. You have Niger that basically had to wiggle their resources from France. They kicked France out. The ending of last year in December, say get out, take your army, your bureaucracy, and they basically upscale their uranium from 80 cents per kilogram to the market value, what Canada sells it for, $54 per kilogram, and now they're one of the richest countries on the planet. I remember I spoke of the Democratic Republic of Congo. They have $24 trillion worth of minerals and wealth beneath their feet, yet they're the poorest country on the planet. You know? And they're coming here, they're showing up in our communities. So we have to look globally and operate locally and in a way that intersects all layers of government as well as institutions within our region, whether that be the police, education, and so forth, to help build a strategy, whether it be physical buildings, whether it be advocating on behalf of various governments for the monies that we need, because yeah, we do have an image problem where people think we're wealthy over here, right? And which doesn't scale down, particularly in the black community. So I would just say, and the stats that you gave, I was gonna actually say most of them and add some more, but I would, well, maybe I won't go there, but just say that in order to build a system that doesn't increase gaps and that address the gaps and that is surgical and very strategic and that track outcomes, as I noted, it has to be equity focused, and what equity is simply giving people what they need so that they can have access to their bodies, to their dreams, to their talents, their giftings, and to societal resources. So you have to treat people differently by giving them what they need so that they could have equal access to our institutions and to society and to their bodies and themselves. And we have to address anti-black racism so we don't expedite the gaps that exist. And anti-black racism has a specific meaning that was defined, and a very specific Canadian meaning because it originated from Canada. What's the professor's name again? Yeah, Koa Benjamin. And it basically talks about, in very real ways, the institutions that weren't built for us. They weren't built for people of African descent, nor indigenous peoples, nor to us LGBTQ plus peoples, nor people of faiths outside of Christianity, nor people who are not racialized white, and specifically men in particular who are heterosexual, et cetera, et cetera. They weren't built for white women. So they were built for specific folks. So anti-black racism asked us to actually track the legacies of housing, those structural determinants of health, of education, of policing, of health, mental health, all those things, and see how racism that's specific to black people shows up in those institutions. So you need to know the legacy of slavery, colonization, patriarchy, capitalism, mercantilism, and so forth, Christianity, the legacies of those and how they inform our existing systems, to understand how they're showing up in the form of racism that's geared towards black folk, and in the stats that you shared with us moments ago. And with that understanding, then you could address what's happening. You can't without the understanding that I'm speaking of. And I'll just quickly say, in terms of housing, the Housing Corporation of Canada refused to give black folk monies to purchase houses for decades. People have surveyed up to the 1960s, most of them refused to rent to black folk. The last segregated school in Canada actually was closed in 1983, just outside of Nova Scotia there. And in Toronto here, it was 1965. So there were segregated schools that were built for black folk specifically, underfunded or not funded at all. And it was built to raise kids who are docile, who could do menial work and so forth. The police. So anyways, so you have to understand all those histories to understand how it's showing up in the form of racism geared towards black folk, which we call anti-black racism. Right?
Thank you so much, Michael. Lots to unpack there. Absolutely, we could have like a full day of this panel, but we've got to move along, and I want to end with Paul. And I'm just going to give a quote to Paul and just ask you to talk a little bit about what a community of care would look like when we're talking about hospitals, police, schools, all of that. And the quotation is, black adults are most likely to experience higher levels of psychological distress, but less likely to receive the care needed. A study in Toronto showed that black residents were 3 times more likely to be hospitalized due to mental health crises. So are our schools, are the police force, are our hospitals, our communities, are they ready? And what does a community of care look like? What would that model look like?
I don't know. I think we have to have a conversation about it.
Yeah.
I have 3.5 points. So the first is, I've seen the power of a taboo out in the community, being able to listen and respond to the folks at service. I've seen the power of a SAPAC. You know, Lieben mentioned it earlier. For 20 some years, SAPAC was funded at the same level. When this government and this specific Minister Tibolo, came to power, we ended up having a conversation, and we're now at 9 sites across the province, including like a strengthened service at CAMH. We went from $280,000 to $6 million, just over $6 million. Small in the relation to the broader health budget, but a really massive difference for thousands of young people across the province. What am I trying to say, Paul? I'm trying to say, I don't know what it looks like, but I know that if we have the conversation and we figure it out, like, we have to talk to the hardest to reach folks. We have to talk to the folks who may be easiest to access and make sure that we're building something that's going to work. What I've learned through this work is that if we're going to get it, we're going to have to push and we're going to have to fight a little bit for it. It's not regular to have a minister that's in, or a MPEP that's in cabinet, that comes out not just in the election cycle, ongoing, having conversations, roundtables in Scarborough. And that doesn't happen, from my experience, very often. So I think we have to shout out the folks there on that. So this is the half point. I think we should pay attention to that. This is our local MPP here in Vaughan, Woodbridge, you said, and I think that carries weight. So the anchor and the people around the table shouldn't have the minister leave without making sure that he has a clue about what it is that we need before he leaves the room. last piece, the context. The ledge is just about to start back up. People have been talking about perhaps an election that may come up. So if we're paying attention to the signs, we just need to pay attention. Now is the time for us to really make sure that our local MVP, but also the minister, understands what our needs are here. And I think we've heard some of that in the conversation today, but some of that needs to come in an ongoing fashion where we're bringing folks here. So both us and the folks that hopefully will fund this work will understand exactly what's needed to make it successful here. So I'll leave it there.
Thank you, Paul. And I think we have the capacity, the capability, the want, the desire to see that happen. And so I think with all of the voices here today, and you all represent your communities brilliantly, and knowing what we know about where we are with Black mental health here in the region, I think we have a strong collective of voices and experiences to really move this to the next level, the next stage. We know it's an issue. Now what do we do? And you guys have laid that foundation just brilliantly, so thank you all so much. Please stay where you are. I'm now going to ask Minister Tobolo. I'm going to stand for you, sir. You know, I'm going to ask MPP Minister Tobolo, Minister of Mental Health and Addictions here in Woodbridge Vaughan, to just come and speak. You want a chair? We can come.
I could stand.
Are you sure?
Yeah. I've been sitting for a long time.
Yeah, okay. Just to just give us an address or speak to what you heard this morning, but I'm certain that everybody wants to hear from you. So Minister Tobolo, thank you for all of your support and all that you do in your portfolio and beyond, and all the support you've given to Anchor over the years as well, and the Black community in York Region. We support you, and thank you so much.
It is still morning, so good morning, everyone. I wanted to stand because I've been sitting for a long time. I left Ottawa this morning, I got up at 3 and I got to the airport at 4 and flew straight in. So it's probably better that I stand, because if I sit, I may fall over. But I have to say, this was amazing, and thank you so much for the insights. This is what we need more of. You know, the one thing I always say, that Queen's Park is a bubble. And what ends up happening is decisions and policies are developed by people that have a very, very narrow view of what's happening in the world. The example that I use, and it may or may not resonate with you, but when I started as the minister, one of the things I wanted to do was see more resources put into Northern Ontario. And so the first thing I asked, well, how much money do I have? And it was peanuts, just under $8 million. And I basically was looking to weight it to the north, because a lot of issues we have in the south are because there are no services in the north, and people migrate to the south looking for support, looking for help. So I decided on what the plan would look like, and then I was told that the plan has already been made, the money is going to be invested, and yes, Minister, we looked after making investments in the north. She said, well, where are the investments in the north? Because I've got, I'm really curious where you put them, and they sent me the list. And I'm looking at it, I'm thinking to myself, did I miss something? So I called the minister, who was at the time Minister Elliott, and I said, just out of curiosity, the decisions were made by who? Well, typically these types of decisions are made by the bureaucracy and then given to us to endorse. So I looked at it, I said, but I thought we had a conversation, and these investments were going to go into Northern Ontario. Well, they are there. I said, I'm sorry, but I've got the list. Where do you see one investment in Northern Ontario on this list? And she said, Barrie. So I thought, okay, well, I won't tell you what I said, because it was very profane, but I basically said, that's ridiculous. And I made a point of saying it to her and then to the Premier, saying, you go out and do this announcement, because I won't. This is an embarrassment to our government. We are so detached from the reality. And the example of the monkey and the fish, I felt like the fish, because I get it. I know what needs to be done. And I didn't tell the story this time, you did.
Go ahead.
So, no, I'm not going to tell it. Just when Paul and I first met, he came and he had this brilliant plan. And I'm looking at it, I'm going, why is he restricting it to, is it $800,000? I can't remember.
As a start.
Yeah, so you came in for 800. I said, but what are you going to do with $800,000? Don't you need to do something? Last time I checked, it was a Black community in Brampton. It was a Black community. And so we started talking. I said, look, I need to get you more money. Come back.
wrap it up so we can do something more, because this is an important part of our community. If they don't have the resources, how are we? Anyways, that's the kind of running joke between the two of us, that we ended up increasing the funding, and we will continue to increase the funding because it makes a difference. You know, you talk about culturally safe or culturally appropriate services. I can't tell you, I haven't, by the way, on September 11th this year, I don't think you know this, or maybe you do, I completed my doctorate in clinical psychology. So So I do have a doctorate, so I'm not only a minister, but I actually understand the clinical side of it, because it's a doctorate in clinical psychology with a focus on residential therapeutic community for the treatment of substance use disorders and concurrent disorders. So I'm very focused on building community-based treatment and recovery in the community. And to do that, you have to have culturally appropriate supports and services, because if you don't, in effect, what you're doing is you're creating a system where one size fits all. And in this room, you guys all get it. One size doesn't fit all. You know, the issue that always comes up to me is a concern that I have is, where are we going to get the people? How are we going to train the people? I mean, I was at an event with you at Tebu, and when we had a first psychiatrist from KMH that's Ethiopian. And I applaud that, because if we're going to provide culturally appropriate services, you don't need a guy like me trying to figure it out. You need people that have that lived experience and understand the trauma that comes with whatever part of the world you're coming from. You know, we keep on talking about trauma as being something that's from the outside in. Trauma isn't from the outside in, it's what you feel inside. So if I'm not from that culture, how am I ever going to be able to build a therapeutic alliance with someone and understand those actual needs? You know, to me, it's a very simple, plain truth that we really need to address in a way that is, again, appropriate to provide the supports and the resources that we need. That means training the appropriate people and giving those opportunities to individuals who otherwise wouldn't have that training. You know, I was very emphatic with developing the Learn and Stay program so that we could actually have people that perhaps couldn't afford to go and get training in a particular area to be able to go to get that. And it's working really well in the Indigenous communities. And again, encouraging people to get trained in the area of addictions and mental health. Because if we have people trained, we have the ability to then deploy them into the very communities that they're going to serve. And the most amazing thing that I've learned as the minister in the conversations that I had with the students, they all want to go back to their communities. They want to help. So why are we putting obstacles and not finding ways to provide them those supports to be able to get them into their communities and supports? One of the things I've always believed in, Elder, thank you for the opening. That to me was amazing. I do a lot of work in Indigenous communities because I think they have been so underserved for so long that they need special attention, especially in remote communities where they don't have access to services like in the GTA. Every time I listen to the stories that they tell, every time I participated in ceremony, it always opens my heart to, you know, the special things that relate to that particular culture. Today, what you said and what you did, to me, is another example of an amazing opportunity that perhaps it's not shared enough, not just with people that are not from your community, but also within the community. You know, with Shernette, years and years ago, we started something called the Festival of Lights in Vaughan, and that was to showcase the different cultures and the meaning of light, of family, of bread, of grandfathers, of mother, bringing those concepts out and try to share them in our communities to basically start showing everyone that we may have a different approach or a different way of looking at something, but at the end, we're one people. You know, so for me, these are extremely important things, and I say it all the time. I was the minister, I was a Solicitor General for a while. Back in the day, it was called Community Safety and Community Safety and Corrections. And I remember I changed the name to Community Safety and Warehousing. And for that, and a couple of other things, I became the Minister of Tourism, Culture, and Sport. And the next minister, because it was starting to stick, became the Solicitor General. But in my roles, in my first role, I realized that we needed to do more in the corrections. And when you see the overrepresentation of marginalized communities, you realize we're housing people, we're not helping them. And there are programs that we started to develop, and more that are going to be coming on stream now because of the work that we did to identify the needs and utilize that space in a person's life to perhaps provide them the resources they need to habilitate or rehabilitate, depending on what the issues were. But it's an important piece. You know, from there I became the Minister of Tourism, Culture and Sport. That was a really interesting experience because I got to meet the Pope. And the Pope talked to me about the importance of my role as the Minister of Sport. I said, you know, it's a job. And he said, no, you're responsible for the minds of the youth. I thought, this is something Ford should listen to, maybe give me a raise. But, you know, when you think about the role that you have and the responsibility and you take it seriously, you realize that the impact you have on children and youth today is what's going to make a difference in the future. And so what are we doing to nurture the young people in our world? You know, 0 to 3, and you know, the ones that are psychologists and psychiatrists know, 0 to 3 and 12 to 24. If you don't deal with those issues 0 to 3 and issues are created, you're going to try to have to fix it in 12 to 24. And if you don't, and we know 70% of the mental health issues we have for adults could have been treated and could have been diagnosed and treated in that period of time. So what are we doing? Well, we woke up as a government, I think. We have opened now 32 youth wellness hubs in the province of Ontario. I stepped out to go solicit the Minister of Finance to remind him that I want to double that number because we're in a budget process right now. That, and the other thing I want to talk to him about, I think I can say it, is that we need to look at increasing the income of the people that work in the sector because they are underpaid for the work that they do. But when you look at building a system, we need a continuum of care. We need the continuum of care to be built in the community, not just in the hospitals. And I have nothing against hospitals, but when 5% of the mental health issues are acute, and you're getting 95% of the money, it begs the question, why? So we need to look at that, we need to fix that. And for me, when I look at the work that's being done and how we need to approach the future in this area, one of the things I keep on saying is, you've got to be vocal, you've got to be present. I will, my staff is here somewhere, I would love to host all of you one day at Queen's Park to have a lobby day. And I'd like you to come in and hit each one of the ministers and tell them what you see, what you're doing, and have a plan. And I will host that. Pick a day, and let's do it. The last thing that I want to say, and I could talk forever on this issue, is if you haven't figured that out, I'm a lawyer, I'm Italian, and I have a doctorate. So between the three of them, I literally can talk forever on this issue. And I'm very passionate about it as well because I ran a residential therapeutic community for 10 years in Vaughan and worked with people with addictions. And one of the revelations that came to me was that the residential therapeutic community is an incredible tool if it's embedded into the community and you're able to get into it. And of course, the revelation that came to me is that to get into a residential therapeutic community, you need to have a lot of money. And guess what? People from marginalized communities don't have a lot of money. So they miss the opportunity to actually get the help that would make a difference in their lives. System that's been built that does not address equity, does not address, and that's really the reason why I came to government, to address that issue, because we need to build capacity, we need to build it in the community, we need to build a system that is culturally appropriate and meets the needs of the different communities. I want to finish off just by talking about faith for a minute, because it was an interesting discussion that happened at the candidate table. When COVID came in, and I can give you the March 6, 2020 was the date that I completed and announced the roadmap to wellness. If you haven't read it, you should take a look at it because it addresses many of these issues. Again, when you look at it, you're going to say, well, he's the fish, not the monkey. But it is something that I'm fighting to try to get more people to understand and to buy in. And we're making progress. I have to say we are making progress. But one of the things that we had to do immediately close down any kind of community or any kind of group, any places of worship, any place where people congregated, because that was the main way that things were getting worse with COVID. So March 6th, I announced the Roadmap to Wellness. All really happy to go. We're at Ontario Shores. The only questions we got was about this virus that was coming along, and what are the implications going to be? Just think 3 years ago, we had no idea what we were getting into. So I leave fairly depressed, thinking to myself, I just poured my heart into this document, and I got 0 questions, and the only thing we're talking about is potentially a virus that's going to cause problems for the province, the world at that point. So 6 days later, it becomes a global pandemic. We, as a government, decide we have to isolate people, we have to keep them separate. So again, the ones that are psychologists or psychiatrists all know isolation is the beginning of moral injury, which is the beginning of a trauma, which could potentially become PTSD. So we're setting up people to fail. And of course, one of the places that I got really worried about was we decided to also close down the churches and the places of worship, because again, congregate settings. That was one of the first things we opened up, because we started realizing the significance and the importance of having places of worship. When you talk about the biopsychosocial work that Engel kind of looked at, the physical health and the importance of it, the cognitive development of an individual, when you look at the behaviors, the different aspects of a person, we don't always talk about the spiritual element and the importance of that congregate setting and the ability to have community. While eliminating it caused all kinds of increases in issues relating to people's mental wellness. And it was one of the first things we opened up. So I encourage people going to their places of worship. And it doesn't matter who you pray to. What's important is that you understand that there is a higher power and a higher authority. To me, that is critical to having that biopsychosocial, the elements of mental wellness addressed, and it needs to be addressed. Like I said, I can go on for a long time. I'm going to stop there. I just want to thank you for putting this on. It was truly, for me, a learning experience. I took copious notes. I'm going to use that story, by the way, Pastor. I really like it. And it is a great example of cultural sensitivity and how perceptions, right? And so it's a great story. And then all of you, brilliant comments, really interesting. I hope, and I welcome any of you to contact me. I think you all have my number. I'm always available, and I'm always interested in listening, because by listening, I'm getting outside of that bubble, and I'm actually looking to figure out where the gaps are and how we can connect them. And I am really happy to see that the police are here today, because this is what they should be doing, not enforcing, but educating and showing us how we can prevent issues of violence in our communities by being proactive and being engaged. So I appreciate you all being here, and I know you do an incredible job out here, because those mobile crisis response teams are doing a phenomenal job in helping people that are in need. So thank you for being here. Thank you, all of you, for being here, and I apologize if I went on a little bit too long. Thank you.
Thank you so much, Minister Toro. I think lunch is here, team, outside? That comes up? Okay, so we really could have this 9 to 5, really. Like, there's so much more that we could say. The room wasn't available all day, so we have to have this half a day. I do want to get to a few questions if we can, and then as you, if anyone has any questions, and then as you leave, just outside where you're registered will be a packed lunch. I think it's like barbecue chicken and rice and peas, jerk chicken, rice and peas, so pick up a lunch. Are there any questions for Minister Toro?
I have one.
Yes.
Which I wanted to ask the panel, but I thought anyhow. Go
ahead.
Thank you again, Minister. How do you see poverty and racism as an impact on mental health from where you sit as a white person, as a minister, how do you see that fit?
So I'm gonna tell you a little story. So I go to one of the cities that's had a lot of crises when it's come to mental health and addiction issues and overdoses. And I get asked to create something, and my response to them is, you've just asked me to create a merry-go-round. And the mayor says to me, what are you talking about? Like, this is what we need, shelter beds and a detox. And I said, no, what you've just explained to me is that you need a carousel, you need, basically a merry-go-round. And I'm not prepared to do it because I'm not in the business of building carnival rides. So he said to me, but explain to me what you mean. And I think my response is that what I explained to him. In effect, we can do all the work we want in trying to build detox, mental health, whether it's early psychosis, whatever it happens to be that we're trying to address. But if we don't look at the off-ramps that have to be there, and I like that, I've never heard them as structural determinants of health. If we don't address the social determinants or the structural determinants of health, that means a roof over someone's head, food security, education, internet access is becoming one of them, a job. We're never going to help the person with a hand up. All we're doing is perpetuating a system of giving people a hand out. And nobody wants that. That's the amazing thing, that if you give the person the opportunity, they seize that opportunity and they actually are able to reintegrate and to fulfill their lives as human beings. So my answer to you, I don't know if I covered it, but to me, that's critical. Without those elements being addressed, you will never, you're building merry-go-rounds. And like I said, I'm not in that business.
Thank you.
Good morning. I just really have a comment. My name is Colleen Tapp. I'm not from this region. I came in from Brampton, specifically on an invite from Councilman. And so as I walked into the room, sorry, I'll stand. As I walked into the room, so I am Jamaican, so I have a lot of hats. Anyone who's Jamaican knows you have like 10 jobs, right? So I have a bunch of them, and I do get the privilege of working alongside Roots Community Center, and then I actually work in a hospital, so I'm not mad at you for that. One of the things when I came in the room, the first thing that I thought of was, this is a great conversation to have amongst us as individuals who are Black, but one of the things I encourage us to do is to bring the white folks to the table. They are the ones who have a lot of the power in the hospital. My CEO, I work in as a manager of equity and diversity at Trillium Health Partners, and one of the things that we really encourage is to have these conversations with the white folks. They're the ones that are making the diagnosis. They're the ones that are responsible for putting people in. When I come into the hospital and I go into ER and I see folks like me and they get put out, they're the ones who are making those decisions. And so part of it, I love what you said around the institutional structures that we have in place, because there's so much gap in the system. There's so much times that individuals come in for care in the hospital, and we know, as you said so brilliantly, the hospital is not where people with mental health, suicide, they don't belong there. They really do not belong in the hospital because they're not getting the care. I've seen it. And so I really encourage us as a community to not work in silos. I think it's important to have specific cultural services, but I also think it's important for that integrated approach where we can go to CEOs, hospitals, and everyone else and bring everyone to the table. I really want to let you know that there are folks that look like us that are in the institutions, that are doing psychotherapy work, that are working with folks, but we need more. We need Black psychiatrists, we need doctors, we need the education system, we need CAS. We need so much work, and part of that work means that we really have to start to integrate with people who don't look like us. We're uncomfortable. I go into the senior leadership team, I'm uncomfortable because I come in there like, ah! And they come in there like, woo, and they're like, what do we do with you? And I'm like, you're about to learn what you're going to do with me and my people, right? So we need to start to integrate with those folks as well and start inviting them to the table, because they're the ones with the power. They're the ones with the ability to help us break down some of these systems that are not not working right now. And so that would be my encouragement. Let's bring the white people, let's bring the South Asians, let's bring everyone to the table so that we can have the integrated approach. And last, that I'll say, thank you so much for bringing faith into the room. As a minister myself, one of the things that I see with the clients that I work with is the fact if we can get them out of this loophole to recognize higher power, to recognize mind, body, soul connection, it would be such a beautiful thing. So thank you so much for what you say. As a therapist and a minister as well, I thank God for your testimony this morning.
That's a really good point, but it also reminded me of something else. This is really important that this work is in Vaughan Woodbridge, but you stood up here for Brampton. One of the things you have to do is coordinate this as a community everywhere in the province, not just in Toronto or Brampton or Vaughan, Barrie and London, but coordinated. And the reason I say that is, one of the things that I learned when we started the work that we were doing, I put all kinds of resources into Sioux Lookout. The Sioux Lookout has 24 communities that fly in. I built the resources for them. I sized it to what I thought their needs were going to be, about 48 beds we gave them. And all of a sudden, a whole bunch of people started showing up from Thunder Bay. And then after the people from Thunder Bay, the drug dealers came in because they had a ready market. That became a huge issue in Sioux Lookout, from policing and everything else. So when we're going to develop concepts or develop how this rolls out, what we need to do is ensure that we are covering the province and we are building these out so they become a hub and spoke. We have the regional responses and then try to tie them together with the resources. So this could be the pilot, Brampton could be another pilot, but I think, Paul, one of the things that we started working with is, where else do we need to go? What else do we need to do? And again, I always say, you got to dream big. You know, bring it to the table. We may not be able to do everything, but if we don't start, and we don't start getting the data that supports why this work needs to be done, it's impossible to get it done. The days of throwing a dart at a dartboard to figure out where you're going to invest money as a minister, those days are disappearing, because the resources, you know, we invest $86 billion a year in health in the province of Ontario. It's getting to the point we can't sustain it anymore. So we're going to have to be a lot smarter and figure out how to connect these pieces in a way that's going to give us the results and meet people where they are, and not waste money trying to do a one-size-fits-all that isn't going to work.
Thank you for that. And if I can just share with you guys inside of your program, I was thinking big and I was dreaming big. And so I created a document here that just says it's fictitious, but my dream would be, and the page just says, imagine if we had the following to support Black mental health. A York Region Black Mental Health Hub, a Black mental health healing space, Jiwa Youth Mental Health Drop-In Center. Jiwa means spirit in Sanskrit. So a Jiwa Youth Mental Health space for our Black youth. The Helm, an African Canadian Cultural Center in York Region. Or the York Region Black Mental Health Collective, which has started with just me and like 4 people who've planned this for months, but let that grow into allies and sector support, and that we can meet once a month and talk about the issues. We can get funding for some data collection. We can really create a collective here that will basically be the underpinnings of something like this. And that serves my dream, is to have the resources here within the region that we all get in Toronto, because we're here. And I think York Region has a capacity to be able to do these wonderful things. So that's my ostentatious dream, is to want to be able to have that. And I think we have the support here and the partnerships here, and I so appreciate that. Is there anything else for Clovis and okay, Valerie, come on up. Thanks, guys. Oh, sorry, appreciate it.
There are 2 hands, yeah.
Okay, thank you, Shernette.
Yeah.
Thank you to the organizers who put this together. My name is Teresa Brand Hall. I am the founder and chair of the Newmarket African Caribbean Canadian Association. Thank you, Minister, for your remarks and for yours. That was brilliant. So I met with our MP, Tony Van Bynen, yesterday, and one of the things that came up in the conversation was that there was $100 million that was going to be allocated. I think it's coming through CMHA. And I just wanted to know if you were able to provide some clarifications in terms of how that's going to be streamed in terms of mental health, specifically being allocated for mental health. So in the Black community. So I wanted to know a little bit about how that's gonna stream out, and also we're currently working with South Lake in Newmarket through a funding that's coming out next year. So we're getting a little bit, about $500,000 or so to put, because we've been doing mental health services and support services since 2019 in our community. And so part of that process entails that money is channeled through York Hills. And so part of the reason why it's being channeled through York Hills is because the infrastructure is needed. So infrastructure like a privacy officer. We would need to get a COO, right, for example. So where in the whole strategy and structure that we're building is going to allow, and I'm hoping it will through this conversation, this brilliant conversation that we're having, I would like to see some core funding for these infrastructure that we need to build. Because so to bring it into community and to fully support this community strategy, there needs to be funding allocated to build those core, I think Paul talked about the resource center, right? Because you can't keep volunteering. So I'd like to hear some core funding.
I'm not aware of the $100 million that you're speaking of. I'm going to have to find out for you. The investments that we have with the federal government is $3.8 billion over 10 years. And we're about halfway into that right now. If there's an additional $100 million, I will have my staff look into that. I'll get you my card, and that way we'll follow up with you. Or if you give me your contact information, we'll follow up. In terms of building the infrastructure, the money that we typically invest is money into programming. There are funds that are available to, in terms of setting up and organizing and that kind of thing, but typically what happens is a proposal is sent in, and then that proposal gets looked at, and then it's usually endorsed, and it moves into Ontario Health, who then looks at, what type of funding it is, and the appropriateness of the investment, all those types of things, with the endorsement or without the endorsement of the minister, usually with the endorsement. So I to be more specific, I need to see the proposal that you're looking to create and implement, and then from there we can look at it and see how we would be able to fund it.
Thanks, Teresa. Thanks so much, Minister.
Thank you.
And I'm going to turn over to our lovely host, Clovis Grants.
All right. We're slightly over time, but I think you'll grace us with a few more minutes just to wrap some things up. Wasn't the conversation amazing? Yes, indeed. And I certainly want to take this time right now to thank our panelists. So Paul, Michael, Lieben, Pastor Juba, Pastor Tom, thank you so much. And but thanks won't stop there. There's been. Let me pause for a quick second. There are no checks in there.
You never know.
We're doing it off the side of our desks. Alcohol? There is no alcohol even. But it's a token of our appreciation for giving up your time, your expertise to the community. There's been somebody who's been spearheading this work pretty much from the beginning, and we have certainly appreciated her leadership, and of course that's none other than your next.
I have to say your unwavering dedication to our community is nothing short of inspiring. You have tirelessly stood up for those who often go unheard, becoming a powerful voice for the voiceless, your selflessness in representing the Black community, women, youth, families, seniors, all underserved population, and not just the Black community. I've seen you do things within communities. It won't go unheard. We want to thank you for the relentless commitment and the work you do, and the true championship you use in leading such initiatives. I know these conversations, we've been thinking about it for years, but to kind of see this come into fusion and hear the voices of the people, I just want to use this opportunity to say there is a collective. There is the Black Mental Health Collective of York Region. Bring your voices in. Bring your voices in. I like how you speak about diversity. We have a whole ton of people, including York Region Police, a lot of people on the table talking about this. This is where it begins. This is not where it ends. So, Shanette, your leadership brought that through. So I want to say thank you. And on behalf of everyone, people. What is this?
Thank you.
She wasn't expecting the last, there are two more things I just wanted to flag before you go. One, we'd love to take this moment to have a group shot. And Fitz, we're best here.
The photographer, where do you want us, Ravon?
Fitz is good.
Oh, you're doing group shot. Oh, sorry, I thought the photographer was. Yeah, let's do a group shot.
Yeah, where?
Right here in the front is good, Minister. Panels, you want to come on through?
And then the second item is lunch is out there. So please grab something. I mean, we have this room till about 12:30, so expect a follow-up from us in the next week or so please expect that. And so grab your lunch, make sure you're in the photo. It's a great way to and send questions. There's some information where you can send us any questions.
Sure, I'll see you the next week.